The precautionary measures include no handshaking. But what is one to do when you just pronounce the official opening of a bread factory or receive a donation? It's tradition among Namibians to shake hands, and it may take some time to get used to just a thumbs up. COVID-19 can also spread from contact with contaminated surfaces or objects, where it may remain for several hours. This trophy that exchanged hands will also end up at home, with probably more hands and people to admire. Door handles are one thing that one cannot avoid, a shared responsibility along with microphones at gatherings. All that requires some measure of precaution. One should also be careful when licking your fingers after touching objects, and here mobile phones particularly come to mind as objects that may carry the virus. Face touching is another common and often unavoidable habit, though take caution that being touchy when ill may just lead to reinfection, says health experts. As you may see in these visuals during this week's Parliamentary Standing Committee on Public Accounts hearing of the Namibian Veteran Associations Fund, some could not help touching their faces. One of those in attendance who constantly touched his face did so 17 times in a matter of less than 10 minutes. COVID-19 may not only cause a global economic recession, but a social recession as well, which some have termed social loneliness epidemic. Social recession keeps people from making physical contact with one another, such as visiting. Greetings is a global language many cannot do without, and some are seen practicing creative and safer greeting methods such as these. Perhaps something Namibians too needs to effectively reinforce given the backdrop of confirmed COVID-19 cases. Signs of COVID-19 to be on the lookout for include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations by WHO include regular hand washing, covering the mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs, and avoiding close contact with anyone showing symptoms of respiratory illness.